When we hear about diabetes, most of us think about needing to watch our sugar intake or checking blood sugar levels. But what many people don't realize is that diabetes can also make it harder for couples to have a baby. Let me explain how this happens in simple terms. For women with diabetes, one of the biggest problems is a higher chance of losing the baby early in pregnancy. Here's why this happens. Think of your womb like a garden, where a tiny seed needs to grow. The lining of your womb is like the soil in that garden. For a healthy pregnancy, this soil needs good blood flow to provide nutrients and oxygen, just like how plants need water and nutrients from good soil. When someone has diabetes, high blood sugar damages the tiny blood vessels all over the body, including those that feed the lining of the womb. This means less blood, oxygen, and nutrients reach the area where a baby would try to grow. Sometimes the tiny embryo can't even attach to the womb wall. Even if it does attach, the poor blood supply makes it much harder for the baby to survive, leading to early pregnancy loss. Many people with diabetes also struggle with being overweight, which creates another problem. Extra weight messes up the body's hormone balance, the chemical messengers that control things like monthly periods and releasing eggs. When these hormones are out of balance, women may have irregular periods or not release eggs regularly, making it much harder to get pregnant naturally. Now let's talk about how diabetes affects men, which is just as important but often gets overlooked. The main issue is that diabetes hurts sperm quality in several ways. Think of sperm like tiny swimmers racing to reach and fertilize an egg. Each sperm carries important genetic information, like a blueprint for making a baby. High blood sugar creates harmful chemicals in the body called free radicals. These act like tiny troublemakers that damage the genetic blueprint inside sperm. Studies show that men with diabetes have much more damaged genetic material in their sperm compared to men without diabetes. Unlike other cells in our body that can repair themselves, sperm can't fix this damage once it happens. This means the sperm might not be able to create a baby, or if they do, the baby might not develop properly. Diabetes also affects how well sperm can swim. Remember, sperm need to be good swimmers to reach the egg. Research shows that men with diabetes have sperm that swim more slowly and are often shaped abnormally. If sperm can't swim well or are the wrong shape, they can't do their job of fertilizing an egg. There's another problem too. Diabetes often lowers testosterone, the main male hormone responsible for making healthy sperm. Lower testosterone means fewer sperm are made, and the ones that are made aren't as healthy. It also reduces a man's interest in sex and can cause problems with getting or keeping an erection, making it even harder for couples to conceive. Here's what makes diabetes particularly challenging for fertility. It's like a domino effect. High blood sugar doesn't just cause one problem, it creates multiple issues that all work together to reduce the chances of having a baby. In women, it affects blood flow, hormone balance, and weight. In men, it damages sperm, reduces hormone levels, and affects sexual function. The good news is that many of these problems can be improved. When people with diabetes work hard to keep their blood sugar levels in a healthy range through proper diet, regular exercise, taking medications as prescribed, and working closely with their doctors, fertility often improves significantly. The key is getting blood sugar under control before trying to have a baby and keeping it controlled throughout the process. For couples dealing with diabetes and trying to start a family, getting help early makes a big difference. Working with both a doctor who specializes in diabetes and a fertility specialist gives couples the best chance of success. The most important thing to remember is that diabetes affects your whole body, not just blood sugar levels. But with the right care, knowledge, and support, having diabetes doesn't have to mean giving up on dreams of parenthood.